Time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, a story that made headlines all over the country. A new study questions the value of mammograms to screen women for breast cancer. John?
Anthony, as you would predict, there was a lot of confusion and frustration about the report, which appeared Tuesday in the British Medical Journal.
Almost 90,000 Canadian women ages 40 to 59 were screened over a 5-year period. Researchers found no difference in deaths from breast cancer between women who got mammograms and those who didn't. The women were followed for up to 25 years. In addition, 22% of the cancers found by mammography were considered unlikely to ever cause death.
Okay, just like that.
In recent years, controversy over the value of mammograms has led to confusion among both patients and physicians. In 2009, a major independent task force said women could consider waiting until age 50 for their first mammogram. The previous recommendation was 40. It also said women 50 to 74 should get mammograms every 2 years instead of every year.
John, why do these guidelines for mammograms keep changing?
Anthony, because we're not all genetically identical rats, where you can do the perfect study, have one group do this, one group do that, and see what happens. We're different. It's tough. From country to country, they differ. The populations, what the mammography technically were like, the actual x-rays, whether they're doing self-exam. But I can tell you, it's anywhere from a 30% reduction in mortality to no reduction, as in this study. So it's very confusing.
I get the sense that amongst the medical community, this is also not the conclusion. We're probably going to hear more on this topic.
No, I think that's true. There's been a lot of confusion out there and a lot of reactions. Some people are criticizing the study. I will say that I spoke to the woman who's the head of the task force that advises us and gives us these guidelines that we mentioned in the piece, and she said that right now everything stays the same. They are going to reconsider it in 18 months. But the person who wrote this article said to me, look, it's not like you're comparing doing mammography to nothing. These women were taught very carefully to do self-exam. So that's another thing to keep in mind.
All right. So, Holly, what should women do at this point?
Well, you know, as important as it is for us to have this discussion in the medical community, I mean, I love talking to John about it and thinking about all these studies. The single most important discussion that needs to happen is between each woman and her doctor. These guidelines are just what they are, which are guidelines. They're not for everyone, and they need to be tailored specifically based on your family history, based on your personal history, and other things going on in your life, whether or not screening is right for you. So it's really an individual thing.
Also this week, there was surprising news about pregnant women and narcotics. A study of more than 500,000 mothers-to-be found that more than 14% were prescribed opioids at some point in their pregnancy. So, Holly, is this about pain management? What in particular are these women getting these drugs for?
It is. These are narcotic painkillers, drugs like hydrocodone, oxycodone. They're found in medicines we've heard of, like Percocet and Vicodin. Women are given these medicines for about a week or less. The most common complaint that they're used for is actually back pain. But the issue is the jury is still out, even whether these drugs are safe for a week or less. It looks like they are, but we really can't say for sure.
Well, what can you do if you need pain relief, but you don't want to take these narcotics?
Well, some drugs we know are safe in pregnancy, like Tylenol, so we really should focus on those. But do as much as you can without medication, whether it's stretching, acupuncture. There are great chiropractors that focus on pregnancy, relieving that back pain. So whatever you can do that doesn't involve drugs, the better.
In London this week, scientists announced they will begin sequencing the DNA of King Richard III. The king's long-lost remains were discovered under a parking lot about a year ago. He was killed in battle in 1485. Researchers hope to discover what kinds of diseases Richard might have carried. They're particularly interested in seeing if he had a genetic predisposition to scoliosis, which could explain his famous hunched back.
Another story that got a lot of attention this week was an article that appeared on the front cover of the New York Times Sunday magazine. The headline asked a provocative question: does a more equal marriage mean less sex? So, John, we all sort of have an opinion on this one, but I want to know what were the highlights from the article?
Well, Lori Gottlieb is a therapist who wrote this article, and the thought was that guys who do more household chores, just typical thing, you know, cooking and cleaning, folding the laundry, that the woman would be happier with them and that they would be getting more sex. It turns out it's exactly the opposite. The more household chores they do, the less sex per month, down to as low as 1.5 fewer episodes of sex. What a 0.5 episode of sex is, I'm not sure, but anyway, you get the idea.
So, but John, why would being an equal partner make a more equal partner make a husband less attractive to his wife, do you think?
Well, maybe not less attractive in all ways. Mutuality is important,
right,
and friendship is important. But it's complicated, let me just say that. They talked about something which I like, which is something that you could do something about, which is gendered sexual scripts. And what that means is that there may be an expectation when the guy is very stressed out and very tired, he may be less likely to initiate sex, okay? And traditionally, because of these gendered sexual scripts, it may be not felt to be okay for a woman to initiate sex in some relationships. And so that's something I like that you can do something about, because there's a little something that I like to call communication,
yes,
where you can sort of help figure that out.
Holly, it seems to me like they're saying correlation is causation. And as a woman, I hope they're incorrect. But what is the suggestion then? I mean, do we go back to the way things used to be?
No, you know, we do have to keep in mind sex is only one part of a happy marriage. Not everybody agrees with me, but statistically that's supposed to be the case. So actually the lowest divorce rates are in families that are a little bit more egalitarian. Actually, where men do 40% of the housework and where women earn 40% of the income. So a happy sex life is one thing, and a happy marriage may not always correlate with that.
I think there's going to be a lot of debate on this one.
Yeah.
Ongoing. Finally this week, some new advice for parents. The American Dental Association says that a tiny bit of fluoride toothpaste should be used to brush kids' baby teeth as soon as they come in. John, I think a lot of parents normally try to avoid this because they're worried their little kids might swallow this. So why did the ADA make the change?
Because it turns out that a lot of kids are getting cavities, 40% of school kids, and the more cavities you have as a kid, the more likely you are to have cavities as a grown-up. Now, there's a worry if you take too much fluoride, you get this thing called fluorosis, where there's discoloration of the teeth. So they want to have the exact right amount, and so they're coming out with these guidelines.
Holly, I have a 2-year-old. So what exactly am I supposed to do? How do I brush his teeth?
You know, it's about using a very small amount of the fluoride toothpaste, about the size of a grain of rice. And you actually need to do the brushing for them. You know how 2-year-olds especially want to do everything themselves, but the parents really need to go in there and do the brushing for them.
So next time he says I want to do it, I'll say, Dr. Holly told me I have to.
Exactly.
Dr. John LaPook, Dr. Holly Phillips, thank you both.